there, my name is Kang and I'm a part-time student librarian with the IMU Bukit Jalil Campus Library. Here, we're going to do a book review for otolaryngology cases from the University of Cincinnati's clinical portfolio. This book is the second edition in its series and it was edited by Myles Pensak. It was published back in 2017. The book is available through ProQuest's eBook Central platform. It's one of the many online databases that the IMU library has subscribed to for us. This is going to be the web page that's going to load after you click into the book itself, and it will give you a few book details and the description of the book itself to just let you check if this is the book that you're looking for. And at the bottom here, there's the table of contents, which allows us to go through what is which specific conditions are included in this book, and it also helps us to get an idea of what is included in this, what type of conditions are included in the book itself, so we can understand, get a better idea of what's included and what's not included in this book, and if required we can go look through at another book, or if this book is suitable for our needs. So for example, if I were to be looking at an adult otology case, I'll click into here and look at the type of cases are included in this book itself, and I find that tinnitus is included in this book, and it's what I'm looking for. I'm trying to improve my clinical reasoning in for patients coming in with tinnitus. So after I click into it, it will show me directly the chapter for tinnitus itself, and I will be able to look through what is like in a clinical setting. So it will first present with a history of the patient, as well as any examination and its findings in the first section. Afterwards, it will show us some differential diagnosis that we must be thinking of when presented with a similar case. So for example, the patient is presenting with tinnitus itself, so it goes into a basic information about patients coming with tinnitus itself and how we should approach patients with tinnitus, and as well as subtypes of tinnitus itself. So in this case, there's 3 types of tinnitus here: the positive tinnitus, non-positive tinnitus, as well as an objective tinnitus itself. Afterwards, it suggests that vascular anomalies of the middle ear could be a differential diagnosis for this patient. And then it will go into another one would be idiopathic intracranial hypertension. And after it will also give you some of the cases associated with it. So for example, it could be of a venous etiology, palatal myoclonus, jugulotympanic paraganglioma, or it could be a dural AVM, atrial venous malformation. Afterwards, it will also go into the interpretation of test results. So it will be covering the test that which parameters or aspects or qualities we should be looking at in the test itself. So for example, in auscultation, we should be looking at ausculting the upper neck and post-auricular region. If it's diagnosed with carotid atherosclerosis or dural AVMs. We could also be ordering thyroid function studies and looking at the hemoglobin level of blood tests. And in radiologic evaluation, we need a CT scan for this case, and it should be a CT scan of the temporal bone and a 4-vessel angiography would also be useful in this patient. And it will also go into the specific diagnosis in this case, which is a dural EVM, and any medical management, and its surgical management if it is applicable. So for this case, it's a dural EVM, and the therapy for it is a endovascular embolization with or without a micro neurosurgical resection or stereostatic radiosurgery. And it also goes into further detail of the surgical management itself. So for example, it tells us when we would need a surgical surgery itself, and when what is required for the surgery itself. And in some of the cases, we are also given a picture itself of the MRI to with some notes of how it should look like, pointing out how what of the qualities that we should be looking for and what it looks like, and as well as how we can describe the particular features that we can observe. It also goes into the subsequent management itself, so the rehabilitation and follow-up that is required of the patient, as well as a few knowledge check questions at the very end here. The good thing I like about this particular format is that they provide the further reading materials, the references at the end of the section instead of at the end of the book, so it's easier for us to look it up and go dive deeper into the particular topic itself without having to go jump between sections of the book. And another we could also use the search function located in the sidebar to look up for a particular keyword that is particularly hard to find. Or we could also jump between sections of the book using the sidebar as well. So one thing I like about the online reader is that it has a citation feature in which we can directly copy the citation in a few of the popular formats, and we can just incorporate into our references directly like this, instead of trying to use a third-party online service for it. And there's also a feature to copy the exact link of the ebook itself so that we can come back to it anytime afterwards. And one more thing is that it has a highlighting feature so that we are built into the online reader, so that we can highlight it in different colors and that it will stay there for multiple readings. So even if we close the web page, it will still be there. And there's also another there is also a sticky note feature itself in which we can add in we can put in notes or some commentary for this for the particular part, and it will be shown like this, so that we can add in our own miscellaneous notes in addition to highlighting itself. So I feel that that's particularly useful. And it also shows tables for the most common clinical symptoms, so that it helps us to get an idea of what would be the most common complaints come from a patient itself, and then what we should be looking for in cases of tinnitus, and how we can get an idea of what is the most relevant symptoms and what is occasionally absent in patients. So I think that's about it for the book review section, and I would recommend this book particularly to medical students, and to a lesser extent nursing students if they would like to go the extra mile However, it is generally geared towards medical students, and it helps us to develop our clinical reasoning. So I would recommend this to anyone around second year and above, and it is particularly useful in the sense that we are able to go through a case review anytime at our own leisure in a rather concise and straightforward manner itself. So we can go through the cases at our in our own time through these kind of review books without having to be physically present in a clinical setting to be able to learn and discuss with a physician to on what things that we should be looking out for, as basically we are able to have a clinician at our fingertips, and we can like browse through this information anytime without having to be restricted to reviewing the cases at certain times of the day itself as part of the learning process. So that's what I find particularly useful about this book for. What I find this book particularly useful for. And that's about it for this video. Thank you very much for watching.